So this is the setup of a general pediatric patient room. Over here to the right, we have a bedside table that's mobile. You see the IV pole, code blue button. These particular rooms have a hanging Hoyer lift to help lift patients. So everything we need for vitals over there. Obviously the patient bed. There's a couch on that side of the room. That door is for the bathroom, a small desk area, and then you have the sink and TV over here. This particular room is handicap accessible, which is why you see we have a little bit of wider hallways here and a little bit more space on this side of the bed. Not all patient care rooms are this large, but like I said, this one has to be wheelchair accessible. Some patient rooms will have cribs in them, obviously depending on the age of the patient, but this is just a general normal size bed. All right, so one of the things that we use in the pediatric world are diaper scales. So as you can see, it's just a normal scale, and what we do first is place the diaper on the scale to make sure we zero it. So for example, when we're measuring the output of a patient, we want to make sure that we're not counting the weight of the diaper. So we're going to take this knob and move the 0 to here. That way our scale is zeroed at the weight of the diaper, so that when the patient has output, we can then place the diaper that has been used on the scale and it won't count the weight of the diaper. So we use this to help make sure that we're measuring the output of our patients very exactly. All right, so now I'm gonna show you guys how to set up a kangaroo pump, and this would be for feeding, for enteral feeding. So like using a G tube or an NG tube. So this is our pump. This is our bag and tubing setup. So first I'm gonna show you how to load it. On the side of the pump here, this pops open and you have this stretchy part of the tubing similar to the tubing that goes into an IV pump. So in case you ever forget, there are really easy 1, 2, 3 instructions loaded on there. You're gonna put this little tab facing out, stretch the tubing around and set it up in there. Once that's locked into place, you can close it and then your tubing set is in. So we're gonna turn the pump on. Oh. There we go. And then I'm gonna show you how to prime it. So we're gonna clear the settings and start with new settings. Clear. Since this is a new set and there's nothing in it, I'm gonna show you how to prime it. For our teaching purposes, we're just gonna prime with water. So let me grab my water and I'm gonna pour it in my bag here. This would usually be whatever formula is being used that's getting loaded into here. All right, great. So now that we've got water in our bag, we're gonna prime it first, because what we don't want is to attach this to our patient with air all in the tubing and give the patient a whole bunch of air. So what we usually do is prime. So now that we have our water in our bag, we're gonna prime it. So I'm gonna take the cap off here and we're gonna prime. And we'll be able to see the water. It's easier whenever it's formula, but you'll be able to see the water travel through, and we'll stop it when we get to the tip. So I'm gonna touch the prime button and click hold to prime feed. You can see the water start to come around. Sometimes it's best to do this over the trash can in case you get 1 or 2 extra out the tip, you don't make a mess. So right now I can see my water is coming up right there, and I'm gonna stop when I get to the tip. You saw a few little drops came out of there. So in this case, I would now connect this to my patient, but for teaching purposes, I'm just gonna cap it and show you how to set up the pump. So now that we're primed, we know that we have our formula, or in this case, water, all the way through the tubing. We're gonna click done. Now we're gonna click adjust feed and set the feed rate and the volume that we want our patient to receive. So we'll set the feed rate at 50 mLs an hour, click enter, and then decide our volume If this was going to be a bolus feed, maybe we're giving it over 2 hours and it would be a 100 ml volume. Once we've set both our rate and our volume, we double check the screen, make sure that it looks good, and then we click run. And that's it. Another piece of equipment we use in the pediatric world is a breast milk warmer. Ours warms by air, so there's no water or anything in here. You'll place the breast milk in this compartment, close this, and it warms using air. So I'll show you real quick how to set it up. We turn it on. This will be our timer over here, and then we can choose mode either to warm or to thaw. Right now we're gonna choose warm and press enter. Then it'll say, was it in the refrigerator, was it at a room temperature, or was it frozen? What is our start temperature? So we'll select refrigerated, and then it'll ask you how many mLs of breast milk are you wanting to warm up. So we'll take it up to about 110 mLs. Once we click enter, it'll tell you how long it's gonna take to warm that approximate amount of volume up. And then when you click start, it'll go. Right now, it senses that there is no breast milk in there, so it's giving me an error. Maybe if I place my hand in here, there we go. Then we turn green and I can click start and it'll warm for you. Quick and easy. So I just wanted to show you guys really quick a slow flow nipple that we use for formula. So this nipple has a very, very small hole at the top and can screw onto a bottle, either directly onto the bottle of formula like this, or they make separate bottles that you can fill up with other types of formula or breast milk as well. This nipple helps with our kids who have dysphagia, different swallowing issues, who may be having feeding troubles, whether it's that they just get exhausted feeding, they're having to work too hard, and they need this nipple with the smaller opening to help slow them down, or if it's we're just starting to trial PO feeding again, it's a great tool to still allow, especially our little ones, to work on their suck, to be PO feeding and working towards that normalcy, but also controlling, making sure they're safe, and decreasing any risk of aspiration while we're working on our PO. All right, so one of the tools that is specific to the pediatric world is a syringe pump, and this is especially useful for small kinds of medications that would come in a little syringe. As you can see, this is just a saline flush for our teaching purposes, but I'm just gonna show you how to set it up really quick. So the end of your syringe goes in right there. This clamp spins and locks down to hold the syringe in place, and this plunger right here gets pushed up and locks into the syringe. So we'll go ahead and turn it on. This would obviously be the end that is connected to your patient. Like I said, since medication in pediatric world can be a lot smaller, most of it is weight-based dosing. Our syringes could be 10 ml syringes, smaller, bigger, 30 ml, 60 ml. It just depends for intravenous medication administration. So we'll just let it get going here, and then I'll show you how to program it. So it'll ask you what profile you're in. For these purposes, we'll do general patient care. So you can select your medication based on its name alphabetically. For the purposes of this, I'm just gonna do volume over time. So it'll ask you, okay, are you sure you wanna enter your medication using volume over time? We're gonna click yes. It confirms the syringe size, so if this was a bigger syringe, like a 60 ml syringe, for example, it would confirm that. It can tell based on the height and the length right here. It'll ask me how many mLs I want to administer, so for this, I'll just say 8. And how quickly do I want to administer that? So let's say we're gonna go over 10 minutes. Would be whatever the doctor ordered. Enter. It'll ask you to confirm one more time. We want 8 mLs over 10 minutes. It gives you then the rate in milliliters per hour. We click yes, and then press the green button to go. And that's it. Okay, so we're just gonna talk through how to set up suction. When you pull your suction out of your Omnicell, you're gonna have the canister, which goes in this holder on the wall, the lid, and then this is obviously your actual suction machine. So there'll be a few different labels. It'll say patient, vacuum, and then ortho. How we do it, this is always plugged. You always want, obviously, the patient to be attached to your patient or whatever you're using to suction. Your tubing comes in 2 separate parts. So, I'm gonna take this off. Whoa. Patient. You have your tubing set up on the patient end, and this will go to what we're using for suction. This smaller set of tubing gets attached to the vacuum part, which you're then going to attach to your suction machine. On these ones, the attachment is down here, right like this. Perfect. So now that we have this attached, and this is attached to our patient, this third cap is closed. We know we have a closed system here. This we can attach to different suction tips. This one that you see right here is called a yonker. It would attach right here, and it's longer. This is for oral suction only. Also, for some of our smaller kiddos, we have this, which we usually call tip suction. I'll open it up and show you how this one works. So this can be used for oral or sometimes nasal suction. The tip looks like that, and then we have this little cap that comes on here with a hook to make it easy to hang on things. The way that this works, this makes it an open circuit, so suction won't be on whenever this is open, but as soon as you place your finger over this, then it creates the closed circuit again and the suction will run. So for example, we'll turn it on. You can hear it. Right now, this is not suctioning because this is open, but as soon as I place my finger over here, the suction is active. The other type of suction that we have is suction using a catheter. This can be used for deep suctioning, and I'll show those catheters later on. Okay, so this is the last set of suction, or last type of suction I was telling you guys about, and it is deeper suction. So this is a sterile package and a sterile process if you're using it for a trach patient. So I do have my sterile gloves on just for the sake of showing you guys. The package is already open. I opened it beforehand just for teaching purposes. So this part goes into the suction tubing, and this part, so this left hand is obviously contaminated. This end is what goes into the patient. You can either use this to suction orally or nasal, or like I said, we use it for trach suctioning and deep suctioning for our trach patients as well. You can see there are measurements on this suction catheter. A lot of times trach patients have an exact number or measurement that is known to be their optimal level of deep suction, so we use those measurements for that. Again, similar to the tip suction right there, this is a closed system once you place your finger like this, so it really allows for control over the suction. And like I said, it can be either used in the patient's mouth, nose, or for our trach patients, and these do come in sterile containers. Another type of suction that we use in the pediatric world is called bulb suction, and this is something that is kind of similar to a turkey baster, and this can be used, it's especially great for babies. We use it for oral suction and nasal suction. As you can see, it's very soft and pliable. It does not have to be attached to the actual suction machine because it works mechanically. So you squeeze, and then you would insert it, release, to then suction. It can be very gentle, it's very easy to control. Like I said, it's especially great for our super small kiddos, or if you just need to get up into the nostrils or the inside of the mouth, not anything super deep. So added bonus is that it's also portable. Yeah, it's a great little tool. Okay, so while we're talking about restraints, I'm going to show you one very commonly used in pediatrics, and it's an enclosed bed. It has zippers on all 4 sides that snap right up here into little clips. And this is used for patients who are impulsive, a very high fall risk, and who just really need extra monitoring. So staff are the only ones allowed to unclip and reclip, as well as zip up the sides of the bed for the patient's safety. If we need to, we can run lines through zippers in the bed, so even though it will be zipped all the way up, if you look right here, this zipper compartment, it would be a port for a tube or something to be run in through, to be attached to the patient. This is considered a restraint. We do need an MD order. Those orders have to be maintained. The patient must be closely monitored while they're inside this bed. We usually do still put pillows, blankets, patient personal belongings of that sort in there. We try to make it enjoyable for them and feel more like a jungle gym than a little, you know, kind of soft kiddo cage. It's just to keep them contained and safe. So on the topic of restraints, I want to show you guys something we call welcome sleeves. The technical term for them is elbow immobilizers, and I'm going to show you how they work. So this is a tool, a restraint that we use mostly to help keep kiddos from pulling out their IVs or NG tubes or messing with anything else that they shouldn't be messing with. So it's kind of hard to do with one hand. But if you can see here with this one, it opens up really long like that. And how this is gonna work, here, I'm gonna put it on my arm to show you. This particular welcome sleeve is not the proper size for my arm. It should be more snug than that. But what it does is go on the elbow to prevent the elbow from being able to be bent. That way, if there is a tube, a drain, or an IV somewhere, it's more difficult for the patient to grab at it with their hands and pull it out. These can be used both individually, if there's just one arm that's more active than another, or both together, one on each elbow. However, like I stated before, these are a restraint, so you do in fact need a doctor's order and to monitor the patient very closely while you have them in these.